Thank you so much and good evening. We want to welcome you to the 20th anniversary celebration for ICAP at Columbia University. 20 years is a milestone for a not-for-profit organization, and one that has done so much for so many has been outstanding. ICAP's story for the past 20 years is one of growth, expansion, building trust, and partnership.
When I had my inauguration, actually just a month ago, I spoke about the role of great universities in the 21st century. And I said at the time that our first job was to educate leaders for future generations. And the second was to create the knowledge to solve the world's greatest problems. And third, we had to engage and invest in our communities, both locally and globally. And tonight, we're here to celebrate ICAP, which has been doing all three things for over 20 years. ICAP was a pioneer in global health, but also a pioneer in demonstrating how universities can contribute to society. As you know, ICAP came to being as a uniquely effective response to the HIV crisis that devastated sub-Saharan Africa. Wafat and her team of extraordinary public health professionals showed the world how to bring compassionate, successful programs to thousands of communities around the world. And the strategies that they introduced 20 years ago became the model for the global response to HIV. And since then, thanks to ICAP's support, over 50 million people have been tested for HIV, the first critical step. ICAP's work has also resulted in 2.5 million people receiving life-saving antiretroviral treatment. But those impressive numbers only scratch the surface of ICAP's persistent and persistently innovative contributions to global health.
I joined this incredible place a year and a half ago, and it has been my unbelievable privilege to be part of a medical center that does all it can to support and to really benefit from the remarkable light that ICAP gives us. I will say, when I came to Columbia, we were still wrestling with the challenges of the COVID-19 pandemic. And as I joined this community, it was extraordinary. Of course, I had known about ICAP's role across the globe, what it did to save lives in more counties and countries than I could count. But I don't think I understood how it had led this institution, how it had led this city at our time of greatest need. During those uncertain months, I saw how ICAP came together to bring its resources, its expertise, and maybe most importantly, its heart to this city, to this time, to do that work we needed.
ICAP was born in 2003 to accomplish, to demonstrate a new model of care that I know was born in Wafa's help. Family-centered care that could spread out and deliver solutions for survival and for health for individuals in the face of a global pandemic, and that could deliver health for communities and uplift everybody's collective future. This model is a model for our present, clearly, and a model for our future.
I've known Wafa for over 30 years, and I know that she sees no obstacle ever in what she has done. Wafa, we could not thank you more. Please come up. Can you please rise for Dr. Sada?
ICAP's roots run deep in Harlem, in the Harlem community. Those 2 decades when I worked in that community and experienced the searing experiences of the early HIV epidemic have left really an indelible mark on my life and on my career. And out of these very important formative experiences was born our conviction at ICAP that working towards health and well-being for all people, whoever they are, wherever they come from, must drive what we do day in and day out. So ICAP was born at a moment of deep inequity when millions of people in poor countries around the world were suffering and dying of AIDS, while there were life-saving treatments beyond their reach. That was the moment when ICAP was born, with the determination to make a difference and to stop this inequity. Now, 20 years later, we continue to be guided by this passion, a passion for sharing ideas and expertise, a passion for innovation and discovery, a passion for partnerships and collaborations.
We are getting ready to engage in a very highly anticipated conversation. It is the real food for thought for tonight.
The global support for HIV response has been remarkable for the last 20 years. From your vantage point, what do you think we need to do to sustain that level of funding and energy and commitment?
You know, treatment has been such a remarkable success story. The fact that now, today, 20 years in, with PEPFAR, with the birth of PEPFAR, with the birth of ICAP, with incredible partnership with ministries, with communities, with governments, with private sector, with academia, the fact that 30 million people around the world have life-saving treatment of the 39 million people living with HIV, that is extraordinary. The fact that countries have gotten to 95, 95, 95 targets early is phenomenal. Now, we know that there are gaps, that we need to still work hard to close gaps with adolescent girls and young women, with key populations, with children, for example. But the fact that we've come this far, this fast, without a vaccine or a cure is nothing short of extraordinary. So what is it going to take for us to sustain it? I think it's going to take two things. One, it's going to take perspective for us to learn and remember where we were 25 years ago and where we are now. We need perspective to remember where we came from and where we are. And the second thing, I think, is unrelenting persistence. We cannot let our foot off the pedal. We are not yet done in terms of the fight for HIV to end AIDS as a public health threat by 2030.
What you think has worked well in terms of the response?
The fact that today we believe that because of treatment we can actually suppress viral load to the extent that that individual cannot transmit the virus, have saved millions of children from infection, from being infected is magical.
Malawi has made such incredible, impressive achievements in terms of confronting HIV. What do you see as some of the reasons for your success? And then where do you see the gaps specifically in Malawi?
Malawi is a case study of the benefits of global partnership. In 2003, the HIV incidence was at 4.2%. The prevalence was 14%, and in urban settings, it was as high as 23%. But the successes started coming in because of the global partnerships, the coming in of the Global Fund, and all other partners and donors that came in supported Malawi to record the successes that we talk about now. The HIV incidence, as I say now in 2023, it has dropped from 4.2% in 2003 to less than 0.03%. Where are we going now? Where do we go with the response, having registered all this success? As a country, we know that the global partnerships are there, they have supported us, but we also need to take a step to start supporting ourselves as well.
So what do you think makes partnerships actually work and not just be something in name only?
You have to really work on building the partnerships. It's not that you walk in and you just say, we're going to be your partner. It's not going to work that way. It means that you walk in a situation and you listen. You listen and you try to understand what the situation is like. You try to understand what the priorities are. For example, the priorities of the Ministry of Health, the priorities of the people on the ground. And then you work together with them from day one in order to build together what can be a joint effort. And I think also the other issue about the meaningful partnership is you have to think about the breadth of partnerships, include them, obviously the governmental, but I think also very important, particularly in the HIV response, has been the civil society partnerships. And that's a vital piece of the success of the HIV response, I have to say, is really the engagement of civil society, engagement of people living with HIV in determining their own priorities.
Anjali, UN AIDS works in so many countries around the world, and probably on varying features of the HIV epidemics. I mean, how do you share that information? How did those distinctions, help you? Are they a hindrance in terms of your thinking about how to help and advise various countries?
And it's really wonderful that there's the ICAP team from all over the world here, because you know better than I how diverse and different the epidemics are across the globe, across the regions, at the country level, and then even within the country, how diverse it is at the city level or at the county level. UNAIDS is in over 100 countries, with PEPFAR in 55 countries, with the Global Fund, with ICAP, with the governments and communities working hand in glove. And what we see is regional variation, country variation, and this is where, for example, we talked, all of us, and we heard very specific success stories coming from Dr. Rose from Malawi, and we see really incredible success in sub-Saharan Africa, in East and Southern Africa. We see incredible success on the treatment scale up, as the ambassador said, in large part because of what PEPFAR and ICAP and Global Fund, together with the governments and communities, have done. We also see where gaps exist and where new infections are on the rise in other regions where we haven't tackled the pandemic in the way that we need to.
And Rose, in addition to to tailoring, the broad tailoring by country, how much has what you've learned in Malawi dealing with AIDS helped you as you think about other health challenges for Malawi?
I think one of the areas that we have had heavy investments are the health systems through the partnerships that have supported the HIV response. And during COVID, we saw that the health systems are the ones that supported Malawi in its COVID response. For example, we have a network of laboratory platforms, molecular laboratory platforms that were basically, that investment was made for viral load for the HIV response. These are the investments that could be used, that could be repurposed for multi-disease testing beyond HIV moving forward.
Wafa, did you find that what you've learned at ICAP and all of these systems helped you, helped New York, helped in terms of COVID response? And then also, as you look out now into the future, what do you think about in terms of other global health threats and whether our partnerships are strong enough to meet those?
It's very interesting. I think at ICAP we've really felt all along that it's really important to maintain the work in this country, in New York City, in communities like Harlem and the Bronx, at the same time that we're supporting work elsewhere around the world. I'm a strong believer that there's really enormous richness in cross-learning, in learning from the local to the global and the global to the local. I feel like some of the lessons that in partnership and other lessons from the global response would be very valuable to support our US response. I think another important lesson learned, I would say, is the rapid adoption of innovation. It's been remarkable to see how rapidly countries around the world, particularly African countries, have adopted innovation.
Mr. Ambassador, what do you think about as you look out into the horizon and think about the next big global health threats?
When I look into the horizon, I see what all of us are afraid of, which is that it's a question of when the next pandemic will be, not if the next pandemic will be. And then my mind wanders into what that pandemic will look like. That it could be a respiratory virus that causes deaths as the SARS-CoV-1, the first SARS outbreak about 21 years ago, which had a high mortality rate of about 15%. My mind also reflects back 100 years ago when we had a Spanish flu, where in 2 years, 5.5% of the world's population at that time, which was 1.8 billion people, died. So all of that keeps me awake all the time. We should think of truly not falling into the trap of what I call pandemic memory loss. That's why I'm grateful that the State Department has created a Bureau of Global Health Security and Diplomacy.
Can I ask the two young ladies to come up with the ambassador and Wafa, please?
I think we're very happy to have with us here Irene, Gloria, and Munaida. Yeah, thank you very much for being here. And Ambassador is going to hand you this plaque in appreciation of all your hard work and with the Dreams program.
My name is Gloria John. I'm 23 years old. I am a young woman from Tanzania. Thank you, ICAP. Thank you, Dreams program. I am a better person.
So we have achieved by providing them health education and by empowering them by providing them entrepreneurship skills.
Now that's real girl power. Look what happens when you save a life. We are Global Health, a wrap. Good night and thank you so much.